Hello, everyone, and welcome to AtheroVoice, the podcast of the Hellenic Atherosclerosis Society. I'm Fotis Barkas, Assistant Professor of Internal Medicine at the Medical School of University of Ioannina, a board member of the Society, and the coordinator of the AtheroVoice podcast. This special episode is being recorded on site during the 11th Panhellenic Congress of our Society in Athens, where experts from Greece and abroad gathered to discuss advances in cardiovascular prevention and lipidology. It's a great pleasure and honor to be joined by Professor Meral Kayıkçıoğlu, Professor of Cardiology and Director of the Lipid and Prevention Clinic at University, Faculty of Medicine in İzmir, Turkey. Professor Kayıkçıoğlu is a leading authority in lipid disorders and cardiovascular prevention, and today we'll discuss a topic that is central to atherosclerosis risk: physical activity versus sedentary behavior, two sides of the Atherosclerosis Risk Coin. Professor, welcome to AtheroVoice, and thank you for joining us here at our Congress.
Thank you. It's a great pleasure to be here. I want to thank for your kind invitation. It's really a pleasure for me to be speaking also with you.
So, first of all, what's the role of physical activity in the pathophysiology of atherosclerosis? Through which main biological mechanism does regular activity actually translate into less plaque and fewer events?
Almost all studies have documented that physical activity decreases the prevalence of coronary events, cardiovascular mortality, and also the cancers, falls, and all kind of chronic communicable diseases. And this effect comes from, especially on atherosclerosis, comes from the endothelial activation. And the exercise induces some kind of shear stress on the vessel, and this generates the secretion of the nitric oxide. And this is, as you know, nitric oxide decreases the oxidative stress, vasodilatation, and also endothelial dysfunction decreases. So this is very important. Also, exercise induces some secretion of progenitor cells from the bone marrow. These are repairing cells, and these also help to repair the vessel wall. This is also important. Exercise has effect on lipoprotein lipase, leading to a decrease in TG levels, increasing the HDL, and also decreasing the remnants, and all meaning that decreasing the prevalence of atherogenic dyslipidemia. And when you lower the TG levels with exercise, this means that the oxidized LDL is also lowered. The LDL level in general do not change with the exercise, but the oxidative capacity and also the small dense LDL amount decreases with exercise. The chemokines also secreted from the muscles are important here, but there are lots of different mechanisms. But at the end, the apoptosis, ferroptosis, colpoprosis, many mechanisms are activated or deactivated, favoring the vessel health against atherosclerosis.
When we prescribe exercise, many patients ask, what exactly should I do? So in terms of cardiovascular benefit, what really matters more? Exercise intensity, exercise duration, or the type of exercise? And linked to that, what do current guidelines recommend for physical activity in cardiovascular disease prevention?
When we look at the guidelines, almost all of them recommend for adults at least 150 minutes to 300 minutes per week physical activity. The intensity of this activity should be moderate or more. But if it is a vigorous activity, then 75 minutes to 150 minutes per week will be enough according to guidelines. But unfortunately, guidelines are not giving recommendations about the sedentary lifestyle. In the latest update of the European Atherosclerosis Society Dyslipidemia guideline, sedentary lifestyle is accepted as a risk enhancer. But there's no more recommendation about it. Of course, the intensity, the timing, the duration are important for every ages, for every people. But the recommendations are not enough, make people have a less risk of atherosclerosis.
So we have on the one side physical activity, and the other side we have sedentary time that still matters. So if we accept that sedentary behavior is a separate target, the next question will be practical. How can we help our patients reduce this leisure time, especially screen time in the evening, TV, social media, long sitting at home? And what are some realistic strategies you recommend in your clinic?
Studies have shown that if you increase the physical activity, but do not decrease the sedentary time, meaning the sitting time, the screen time, however, whatever you call, the benefit you get is not you targeted. So if you increase the physical activity, at the same time decrease the screen time, sitting time, or sedentary behavior, then this is the most effective way of getting the benefit in terms of reducing the cardiovascular disease and mortality. But it is really challenging because now you know that this is an internet century, and after the pandemic, people are now doing their works at home. Occupational time is also passed with in front of the screens. So it is really challenging, but this should be a habitual life change since school time in early childhood period. So if we want to change something, we have to go to the schools and give some education to the children, teachers, and also the parents. So this should be a part of primordial prevention. This is the most effective way. But for an individual patient with CVD or with high risk of CVD, we have to first check the hours they spend in leisure time, what they do, how they spend it. And this leisure time is really important. If we can change the leisure time period from screen time to physical activity, then we can do a lot of benefit in terms of cardiovascular prevention. And most of the studies from the Pure database, from American surveys, and also UK Biobank data is denoting that even though in patients having high genetic risk, if you decrease the screen time, especially less than 4 hours, or much better, less than 2 hours per day, you get an extremely high benefit in terms of cardiovascular mortality and morbidity. So we have to be successful doing this, but the way is not clear because some variables, some applications, sometimes text messaging from phones can work here, but this should be a part of primordial prevention, primary prevention, and also the secondary prevention.
So before we close, I'd like to ask you to have a look a bit in the future. What do you think is the biggest challenge in flipping the coin? That is, reducing sedentary leisure time and increasing physical activity at the population level? It's more about our environment design, our digital and screen-based lifestyle, or about health systems and policies that still underestimate movement as a real treatment?
Well, this is a new era, and as human beings, we are just now introduced with such a lifestyle. So we are learning all together and realizing the worst effects of modernization, and others. But we need more data on this, and maybe AI could help us to find the right solution, which method will work more effectively in the prevention of the amount of time that we spend in front of the screens, but maybe some warning signs from the computers, laptops, applications about the screen time is passing for example, 1 hour, 2 hour, may can work. Well, also the curriculum of the schools, primary schools, universities, and medical schools could cover physical activity, lifestyle, its importance, and how can we change. This is also a part of primordial prevention. TV shows and TV programs may have a warning about screen time, and some calculators about the amount of calories spent daily. For example, every hour a warning message text could help, but we are not sure if they will work. But we have to learn, and AI, I think, again, I'm saying the same thing, will help us. But in any way, we have to come over this hurdle because this challenging situation is really hard for us because we're using very highly cost drugs, statins, PCSK9 inhibitors. Now we have the other agents. We are using lots of CTs methods to diagnose and use for prevention. But if we cannot complete the puzzle with physical activity and decreasing the sitting period, we cannot succeed at all. So we have to find a solution for this to increase the physical activity and also physical activity during the leisure time. And this, we need more education and warning methods for the patients and individuals. And for our individual patients, as physicians, maybe we can ask for their sitting time, screen time, their sedentary activities during the daytime for our patients. For example, we can use surveys to understand the way of living style for the patients. In general, we use the surveys for studies, but in clinical practice, it could be more beneficial for us, especially before seeing the patient while they're waiting for our visit. Patients can fill some questionnaires about diet, lifestyle, screen time, and so. And while having the patient, our recommendations can give individual recommendations according to the patient's activity level. And so, and I think this is important. A way of understanding the problems of the patient.
So it seems there's a big gap to be bridged in the near future. Coming to the end, Professor Kayıkçıoğlu, thank you very much for this clear and insightful discussion. You have shown us how physical activity and sedentary behavior truly represent two sides of the Atherosclerosis Risk Coin and how important is it to address both in everyday clinical practice. Thank you for joining us today in the podcast, but also in our Congress here in Athens.
Thank you so much. It was a pleasure and honor for me to be all together and replying your questions. Thank you.
And to all of you listening, thank you for joining us. If you found this episode useful, please follow AtheroVoice, rate the podcast, and share it with your colleagues, trainees, and anyone interested in cardiovascular prevention. Until next time, stay active, sit less, and take care of your cardiovascular health. Goodbye from Athens.